It is 11 minutes actually, past 8 o'clock. We welcome Dr. Jeff King into Studio H. It's time for the King Clinic. And we're going to just batter away at you today. We're going to bring up all the things that people are afraid of when they go to a chiropractor.
I'm ready. Let me have
Some
it.
of these will be our own fears. We're just going to work them in under the guise of other people's fears.
I'm going to start off with, I think people think if you're pressing down on their back, on their spine, that they're going to... No, they're not going to walk out of there. They're going to be paralyzed and be wheeled out of your office.
Well, it hasn't happened yet. Yeah, that's a good one. That's really common. In fact, we accommodate people if they're fearful of any pressure or direct force being applied to them. We use a tool sometimes that they feel basically nothing except the results of feeling better. That's pretty cool.
How about on the other extreme, my fear, and I'll say it is my fear, is that I'm going to get addicted to it. I'm going to have to go on a continuing basis.
That's a big one. You have to go forever once you start,
Yep.
right?
Right.
Well, some people want to because they like the way they feel. They like feeling better. But at King Clinic, we try to accommodate people where they're at. We offer them what they need, what we feel they need, and then give them what they want. If someone wants to come for one adjustment and that's it, that's great. If someone wants a program to help them overcome something, a problem, mechanical disorder, shoulder problem, neck problem, what have you, then we do that too. Or if they just want to talk about diet, stress, whatever, I'm there to serve the public in whatever capacity they want.
But what about the person who does want to come back? I mean, is there such a thing as too much chiropractic care? Why aren't we healing ourselves? You know what I mean?
Right,
Going in for an adjustment and says, oh, I feel so much better.
Sure.
Why do we become dependent on that?
Well, some people, it depends on predisposing factors. Now, my mentor was part of a research group that included a woman named Janet Travell. She was the medical doctor and cardiologist to JFK.
Oh.
So she's pretty smart, and she continued to lecture until she was 98 years old. And she got interested in soft tissue dysfunction and the spine and stuff like that because of her own difficulties and problems with the shoulder. So through that, it's very defined. She ultimately identified 250 predisposing factors to problems, mechanical disorders. So many things can happen to you. Chemically, infectious, work, stress, I mean, on and on and on and on. So the causes can be multiple. So we can get screwed up pretty easily, it seems.
How about when you're getting your back cracked and you hear that noise, that pop?
Yeah.
Isn't that breaking my back or breaking a bone of some sort?
Well, seriously, I've always great. Yeah. Well, the answer to that is all that's happening is joint surfaces are being gapped. They're separating a small amount, and gas is being released. Just when you crack your finger.
Oh. No, isn't that bad? Isn't that bad? I heard you get arthritis if you do that.
That's great. Good.
You don't
We
get
know the
arthritis?
answer because he told us, but go ahead, remind
My
folks.
mom told me that.
Oh, yeah. That's old wives' tale. You're going to get big knuckles.
Yeah.
Or you're going to get arthritis from joints popping. Well, the opposite is true. There was a longitudinal study that came out in the British Medical Journal. They looked at people for a long time, knuckle crackers versus non-knuckle crackers. And the knuckle crackers actually had 30 to 40% less incidence of arthritis in the fingers from popping the knuckles. So it's actually healthy for you.
I can't even do it, though. How do you...
I heard it. Just practice.
Really?
people
Everybody
really
can
do
do
it.
it?
But that's,
I'm double jointed. See?
So you know already.
can you fix that?
My
That's an ailment, but can you fix double jointedness?
No.
That's just part of it. How about the opposite? When I go on the chiropractic table and I don't hear the pop, then there's no shifting. So what good am I doing by doing it if I'm not hearing a pop?
Good. Well, any force you apply to the body, and the intention is therapeutic, even if you don't hear stuff happen, and it's not a huge event, something has occurred. Something has occurred, and probably it's therapeutic. If you have a reputable, good practitioner that's above you, working on you.
Now, I do go to a chiropractor when I have problems, and sometimes it takes, so push down, nothing happens. Push again, and like 3 times before it happens.
Yeah.
That's not causing stress somewhere else if it's not going right away?
No.
It's not like, ooh,
Yeah.
whoa.
Exactly.
That person is trying to overcome a fixated area in your body because you're stuck.
Okay.
So they're ramping up the force successively. The least amount to get the result is what's used. I do that too sometimes.
Do you get disappointed when you don't hear a crack as a practitioner?
Nope.
Not at all.
No, I don't personally.
But you can
because
tell,
I
you can
use
feel
tools.
that it's right or whatever.
Yeah, I use tools, and my hands to move the bones manually if the patient wants that. If they don't want that, hey, I don't want you cracking on me, no problem. I'll use my tool. They hear nothing. They barely feel anything. But
well, what's the tool? I've never heard of this.
Well, there are several different tools in the profession. The most common one is called an activator, where it's like a spring-loaded mallet. And it comes out just a matter of millimeters. And it's very specific. The line of drive is perfect. And you're putting a very specific amount of force into a joint or a bone. Take pressure off the nerve.
Tapping on it, kind of, right?
Yeah. And there are lots of different ones, but that's the most common one. We have that, and we have percussors that put vibrational force through your body.
Yeah, how about that? That machine that's like electronic, you know, that
the
feels
laser
like
thing?
yeah, I guess it is where it's electric, and then they tune it up, and it like gives you electronic pulses.
Yeah.
Couldn't that electrocute me? I've had that fear too, sitting at the table.
Actually, that's a really well-founded fear, because it is possible. It is possible.
To be electrocuted?
Well, to get shocked, get zapped. Actually, it's a burn. You get burned.
And
however,
go ahead.
Here's the thing: as long as the practitioner uses new electrode pads on you, you know, those sticky things that stick on you, and they're good about looking at their equipment and making sure it's tuned up just like a car, then that risk is none. You know, but if you're using an old crummy thing, well, it's possible.
Make sure we got new pads. That's my other concern, is laying on the table with that paper. I have this at any doctor, that they didn't, you got this concern, that they didn't change it before the previous patient.
Oh, yeah. Well, I change it in front of them so they see it.
So you go to the King Clinic, you know it's clean. You don't have that fear? Andrew's admitting she has that fear, too.
Sure.
Oh.
Yeah, you get it a little bit?
But we do it ourselves.
You change your own paper?
Well,
okay, gotcha.
Every chiropractor is different.
Yeah. Now, what about the things that you claim you can do? I think people just go, no, there's no way. Like you've talked to, when we first met, talked about children, and that I just thought was like a colic, bedwetting in children. It's like, what does that have to do with chiropractic care?
Well, I always made sure to bring relevant research and to raise the consciousness so we can understand it together. And I try to do that with patients, too. I never make ridiculous claims, because that would be a breach of the public trust. Like I would never say, hey, you know, I can cure cancer in one adjustment. That'd be foolish. That's not even logical. But if there's a mechanical reason for a disorder to be present, and it's affecting the nervous system or soft tissues, and it might not be obvious to you, but it can be pretty clear to the practitioner. You know, if anybody has those fears and unsure, ask them. You know, if they fumble around, blah, 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 well, forget it. You know.
But like if
it's clear right away, you know it, here's literature, pow.
People are going to be, if they're afraid of themselves, they're not going to bring their baby in. But doesn't a baby suffer from post-birth trauma?
It's possible. It's real common, too.
I mean, do you make adjustments? How do you adjust a baby? Because their joints aren't...
Well, they're all cartilage, pretty much. They're not bony yet. So,
yeah, remember we learned that.
So when we say, quote-unquote, adjust an infant, we're talking about very subtle forces. It takes very little. In fact, about 10 to 14 pounds of pressure on a body part to make it move, to make it relax, take pressure off. And that's about enough to make the pink of your nail turn white. It's very little force. And there's no racking, cracking, no quick shifts on an infant. It's very little because their body is plastic. It's malleable, like clay. It's really easy. And their bodies are so reactive because they're brand new. You know, they haven't collected all that trauma, so it's great.
But I set a 2 o'clock appointment. But I know you're going to be late because you're having lunch, so I'm going to show up at 2:05. You know what I mean? You always seem like you're on the doctor or dentist terms. How do you guys handle that at King Clinic? I mean, you're pretty prompt about seeing a patient if they have a 2 o'clock appointment?
We try to, but, you know, we understand that life happens, so we accommodate them. I hate it when I see people waiting. I look out of my, you know, adjustorium or adjustment room, and I see a full house, and people are standing. I start getting nervous.
Yeah,
like, okay, all right, because I don't like to wait. I assume my time is important, and then I know everybody else's is too.
Yeah, that's the question, because I know you guys are real sensitive to that. That's why I brought it up, because I knew your response is that you try to get people in ASAP.
Try to accommodate them. And if they're late, hey, it happens. I've been late before, so it's okay. We try to be pretty human about it, and our staff, we only hire staff for attitude, not skills.
How do you feel, too, about... when I first went to a chiropractor, it was because of a back injury, and I ended up going to my regular physician as well because I was having back spasms and things. And how you feel okay working in tandem with a regular physician or a person seeing both kinds of doctors?
Oh yeah, all the time. In fact, I refer back and forth to someone in town all the time. if someone needs chemical intervention, we make that happen. But this particular doctor realizes, hey, I'm a general practitioner, I don't do what you do, and you don't do what I do. And sometimes my people need that, and your people need this, so what's the big deal? And he's really pragmatic about it, and it's pretty easy.